Erectile dysfunction, ED, isn't just an awkward topic, it's a real challenge that affects millions of men, making intimate moments stressful and emotional well-being take a nosedive. The inability to get or maintain an erection can send ripples of anxiety through your daily life, relationships, and self-confidence. But here's something not many people know: before pills and surgeries, one treatment stood out for ED relief: prostatic massage. It's an old remedy making a quiet comeback. Understanding erectile dysfunction and its impact. Let's be real, struggling with ED doesn't just hurt in the bedroom. It's more than just a fleeting inconvenience, it's a recurring reminder of lost spontaneity and worries about health. Men with ED often report feeling less confident and more anxious. Some might not even know what's causing it. Is it stress, aging, lifestyle, or something deeper? A key point to grasp is that ED isn't unusual, nor is it necessarily a permanent problem. But identifying the cause is crucial, whether it's physical, psychological, or a mix. Modern treatments offer solutions like oral medications, implants, and even surgery, but one forgotten method is gaining traction again: prostatic massage. What is prostatic massage and why did it fade away? Picture a small gland, about the size of a walnut, sitting below your bladder. This is your prostate, and it plays a significant role in both urination and sexual function. Prostatic massage isn't new. In fact, it was used as far back as the 19th century as a treatment for prostatitis, an inflamed prostate. Some early reports suggested it also helped men regain sexual function. The procedure is straightforward. A trained doctor or specialist inserts a lubricated, gloved finger into the rectum to apply pressure to the prostate gland. The goal? To clear blocked ducts, increase blood flow, and potentially reduce inflammation. This can help improve overall prostate health and, possibly, ED. Does prostatic massage work for ED? Here's the truth. Here's where it gets interesting. While prostatic massage might sound like a peculiar fix, it has shown promise for certain cases. A few studies have highlighted that men experienced better sexual function after undergoing this treatment. For instance, men who suffered from prostatitis saw improvement not just in pain levels but in their ability to achieve and maintain an erection. But here's the flip side: most of these studies are small and don't make strong claims. While some anecdotes from men suggest it worked wonders for them, the scientific community isn't fully convinced yet. Why? Because prostatic massage is not considered a mainstream treatment for ED due to limited research. Still, it's not dismissed as dangerous either, making it an option worth discussing with a doctor. How does prostatic massage help with ED? Think of blocked ducts like clogged pipes. Over time, fluid can build up in the prostate, leading to issues. Prostatic massage helps release this buildup, stimulate blood flow, and potentially improve nerve function. Better circulation means better chances of achieving an erection. And for some men, it's just the right nudge their body needs to get back on track. Another benefit? This massage can help reduce mild infections, or clear fluids that contribute to inflammation. So while it's not magic, it's logical to think this treatment could help alleviate physical causes of ED. Safety first: who should perform prostatic massage? Let's pause here to make something clear: this is not a do-it-yourself kind of treatment. If you've been tempted by YouTube tutorials promising quick results with DIY techniques, stop. Prostatic massage is a targeted medical procedure that should be performed by a doctor or specially trained therapist. Why? Because trying it on your own or with an untrained person could result in more harm than good. Bruising, tearing of delicate tissues, and even infections are risks. If you're interested, speak to a healthcare provider who can either perform the treatment themselves or refer you to a qualified professional. Make sure to check if your health insurance covers it, as many plans might only do so if a licensed medical doctor is involved. The prostate massage process: what to expect. The process is similar to a digital rectal exam. A doctor will ask you to lie on your side or bend over, and they'll insert a lubricated, gloved finger into the rectum to reach the prostate. Pressure is applied gently but firmly. While it shouldn't be painful, some men might find it a bit uncomfortable. During this massage, it's not uncommon for a thin, milky fluid called prostate fluid to be released. This fluid's release can be a sign that the ducts have been cleared. How often is it needed? In studies where men experienced benefits, treatments were performed multiple times a week over several weeks. But keep in mind, it's important to have a healthcare provider guide your treatment plan. They'll help determine the frequency and duration based on your individual needs. Potential risks and red flags. While prostatic massage is generally safe, it's not recommended for everyone. If you have anal fissures or hemorrhoids, the procedure could worsen these conditions or lead to infection. And while rare, there's always a risk of bruising or tearing if done incorrectly. If you notice any rectal bleeding afterward, seek medical attention immediately. The debate: prostatic massage versus modern treatments. Why isn't prostatic massage a mainstream solution today? With the arrival of fast-acting oral medications and advanced surgeries, many people lean toward these more straightforward treatments. Pills like Viagra or Cialis can be taken discreetly and act within an hour. Surgeries can offer more permanent solutions for some. But for men who are exploring all options or can't use medication due to side effects or health conditions, prostatic massage might be a worthwhile addition to their treatment plan. It's an avenue that acknowledges the importance of addressing prostate health and its role in sexual function. Does prostatic massage replace other treatments? No. It's essential to think of prostatic massage as one tool in a larger toolkit. ED can stem from multiple causes, including psychological factors, heart disease, diabetes, and more. That's why it's vital to have a conversation with a doctor who can guide you through testing and treatment options. Remember, prostatic massage alone may not cure ED. But when combined with lifestyle changes like exercise, reduced stress, better diet, or even cognitive behavioral therapy, it can be a part of an integrated approach. The final takeaway: what's your next step? Dealing with ED can be overwhelming, but silence isn't the answer. If you've been facing ongoing issues for weeks, reach out to a doctor. They can explore the underlying causes and suggest appropriate treatment options. If you're curious about prostatic massage, bring it up. While it might not be a cure-all, it's a viable option for some men. Think of your health as a puzzle. Each treatment, test, and conversation helps put the pieces together. Prostatic massage might just be one piece, but every bit counts. Don't be afraid to ask questions and take charge of your well-being.